Discontinuing orders and power plans. Your patient no longer needs Cipro and you want to discontinue it. Locate the order in the medication section of the order's profile, right-click on Cipro, and select Cancel/Discontinue from the menu. The order detail window appears indicating you need to select a discontinue reason. Select a reason from the list on the right, click Orders for Signature, and then you'll select Sign. The Cipro order now appears with a discontinued status in the order's profile under the Inactive heading. Next, you decide that you no longer need the IM short admission orders. There are two ways to discontinue a power plan. The first is to locate the power plan on the order's view pane, right-click on the name of the power plan, and select Discontinue. The Discontinue window will appear in the event that you want to keep some of the orders in the power plan. You want to keep the activity order. Place a check in the box next to the order, click OK, select Orders for Signature, and sign. The IM short admission power plan orders have been discontinued. The orders appear with the status of discontinued or completed, with exception for the activity order that you kept. The second option for discontinuing power plans is locating the power plan from the order's view pane and clicking on the blue Discontinue icon. The Discontinue window appears and you decide not to keep any of the orders. Click OK, then Orders for Signature, and sign. All of the orders appear as discontinued or completed. Adding an admission or working diagnosis and documenting a problem in the problem list. Now that you have reviewed all of the orders and added an admission power plan, you need to add an admission or working diagnosis. You will need to document a problem on the problem list or indicate that the patient has no chronic problems. You note that this patient has chest pain as their reason for visit. Select Problems and Diagnoses from the menu and then click Add. This patient's chest pain was due to angina. Type angina in the yellow box and click on the binoculars to search. In the Diagnosis search box, select Cardiac Angina and click OK. In the Diagnosis Type field, Working is defaulted and you want to change the type to Admitting. Click the drop-down arrow to select Admitting and click OK. The Admitting diagnosis of cardiac angina displays in the Problems and Diagnosis section. Next, you need to add a problem to the problem list. Diagnoses are encounter-specific, while problems stay on the patient's chart across all encounters. If the patient does not have any chronic problems, click on No Chronic Problems. To add a problem, click Add in the Problem section. You've identified that your patient has a chronic problem of diabetes mellitus. Type diabetes in the yellow search box and click the binoculars. When the search box appears, click on diabetes mellitus and click OK. Click OK to return to the main section of the Problems and Diagnoses section. Diabetes mellitus now appears on the patient's chart as a problem. Home care order process for residents and mid-level providers. Residents and mid-level providers can only propose home care orders. Per CMS guidelines, the ordering physician must be identified because only the ordering physician may order home health services, certify that a face-to-face encounter occurred, and that other eligibility criteria are met. The ordering physician must co-sign any home care orders entered by a med student, resident, or mid-level provider via the Message Center inbox. A home care order must be used to order home care for a patient. If a discharge diagnosis has not been added, you will be prompted to enter a discharge diagnosis before entering the home care order. You are the ordering physician and have determined that your patient is ready to go home with home care. Before you place this order, you realize that the required discharge diagnosis has not been entered for your patient. Click on Problems and Diagnoses from the menu, and then to add a diagnosis, click Add. Your patient's discharge diagnosis is congestive heart failure. Type CHF in the yellow diagnosis field and click the binoculars to search. Select Acute CHF and click OK. In the Type field, click the down arrow to select Discharge, as you want Acute CHF to appear as a discharge diagnosis. Select OK to add the diagnosis to the chart. Now you will see that discharge diagnosis has been added to the chart. You are now ready to add the home care order. Select Orders from the menu and click Add. In the Find field, type Home and then select the home care order. After selecting the home care order, the notification to verify the correct ordering physician will appear. This notification will also remind you that the order needs to be co-signed by the correct physician. Select OK to close the window. There are 5 missing required details that are highlighted in yellow. Fill in the required details and click Sign. After refreshing, the home care order appears in the Orders tab with a caduceus symbol indicating that the order needs to be co-signed by the supervising physician. The home care order becomes authenticated when the ordering physician approves the order. We have included a resident home care order process checklist for your information. You have finished the video for computerized provider order entry. Thank you.